the work of Shelby County must continue. That's why the budget we produce, even though this is a challenging budget year, will be lean and it will be balanced. The budget proposes serious cuts in spending, and the budget requires Shelby County government to make some really tough choices, like every American household or every small business at this time. However, the budget I propose to the County Commission at 3 o'clock today will refocus county government in light of this public health emergency. The budget will include strategic investments in education and public safety, public health, emergency preparedness, and in strengthening and expanding our social safety net. We must be ready to meet the needs of those who have been hard hit by this global pandemic. If we focus on those areas, not only will we be able to help working families, we will be able to get on the path to recovery. Shelby County government will stage a comeback. Second, let me mention our testing capacity. Testing continues to be a top priority of the Joint Task Force, and testing access continues to expand. Not only do we have the usual testing sites with the Fairgrounds or Tiger Lane as a centerpiece, additionally, last week, Christ Community opened up 2 testing sites at Frazier and in Hickory Hill. We're testing about 750 individuals on average per day, and since the start of this operation, we have tested nearly 20,000, or about 2% of our residents. In a moment, I want to invite to the podium Bobby White, a representative for the Chamber, because we have an important event on the horizon. First, let me say that local businesses are the backbone to Shelby County. The restaurants, the movie theaters, the retail stores, the beauty salons and nail salons and barber shops provide important services to our residents. Our major corporations like AutoZone and Federal Express, International Paper, and others employ thousands of our residents and help us to make sure that we can take care of our families. As the country enters into the conversation around reopening our economy, we want to make sure that our local employers are prepared to conduct business in the shadow of a global pandemic. Our greatest priority in Shelby County is to make sure that our residents are kept safe. In the coming months, as we discuss our local economy, we want to equip our local business community with the best practices and resources to allow for sustainable and safe operations that ensure that we can continue to work to flatten the curve. That's why today we're sharing that on Tuesday, April the 28th, we will partner with the Greater Memphis Chamber to host the New Normal Virtual Summit. This summit will feature 4 micro-conferences for government sector employers, number 2, Shelby County large employers, number 3, the food and hospitality industries, and finally, our small businesses. Registration is free and available at http://covid19.shelbycountytn.gov. Again, covid19.shelbycountytn.gov. And at this time, here to share more information and steps that the Greater Memphis Chamber has been taking to ensure that our local business community is ready to operate safely when the time is right, I'd like to welcome to the podium Bobby White, the Chief Policy Officer for the Greater Memphis Chamber.
Thank you very much, Mayor Harris. It is very good to be here on behalf of the Greater Memphis Chamber, our President, Beverly Robertson. Over the last several weeks, we have at the Greater Memphis Chamber seen ourselves as being somewhat of the first responders for the business community along with local government. In the same way that we often see when tragedy strikes in many ways, it is local resources and local partners who get together and help before we get help from Nashville or before the help comes from Washington. And we've tried to be in that position and partner with our local resources, our local government, nonprofit organizations to provide support for our business community, which we know has been deeply impacted by this pandemic. One of the things that we have done along this way in terms of providing resources and trainings and opportunities, we want to very much give appreciation to our friends at the Shelby County Health Department. We've hosted weekly calls with the health department to ensure that our business leaders and owners, as well as employees, employers, have been updated with best practices and things that they should do as we face this pandemic as a community. In addition to keeping our businesses safe, we also want to ensure that we help keep local businesses solvent. That's why we've partnered with various partners to provide critical information about available loans, grants, other resources to support area small businesses. I want to remind us all that in addition to the anchor institutions that we represent for the Greater Memphis Chamber and those anchor industries, we're very proud to also say that almost 89–90% of our membership are small businesses, and we fought the good fight as much as we can on behalf of all small businesses. We remain in frequent communication with our national, regional, and state partners and state government. Of course, local government. We're very happy that Beverly Robertson has been named, not only is she a part of the task force, this joint task force, COVID-19 task force at the local level. She's also a member of the Big Four urban task force, as well as Governor Lee's task force, as we look at what recovery will look like in the coming weeks and months. We've taken swift actions and provided advocacy at the federal level with the conversations we've had and have advanced with our federal representatives. And funding at every level, we sought to do what we can to translate that information for our local business community. Finally, we've embraced innovation. As I mentioned, we've had these virtual webinars which provide tremendous insight. Social distancing doesn't mean that we can't remain a source of information and support for thousands of businesses that we serve. That's why we're very happy and privileged to partner with Shelby County Mayor's Office to bring much of this information to you during what will be this virtual conference on April the 28th. We know that the local economy will reopen in a more robust way as time passes, but we ensure that we want to reopen responsibly, and we take that on as a mandate. And as we do this, we want businesses to be ready. Next Tuesday, we invite you to hear from our lobbyists, our partners, learn from some of the industry's top leaders as they give information to us regarding creating safe workspaces, and hear about how we can all embrace innovation for the sustainability operation of our overall business community. This is our new normal, and we want you all to be prepared as we again prepare to reopen responsibly. As mentioned, COVID-19.shelbycountykn.gov is where you register and join with us and register online, and we hope you will be able to join with us on April 28th. With that said, this is a voice we've heard from the business community quite a bit. I'd like to introduce to you our Shelby County Health Officer presenting, Dr. Bruce Randolph.
Good afternoon. Today I would like to give the update from Shelby County Health Department COVID-19 daily report as of April 20th, 2020. Shelby County has 1,807 cases, 38 deaths, and a total of 19,195 people have been tested. Tennessee total cases of 7,070. We'd also like to give you an update on our nursing home clusters. Carriage Court Assisted Living Facility reports 4 deaths, 7 residents who are positive and 1 staff. Christian Care Center Memphis reports 11 residents who are positive and 3 staff who are positive. Parkway Health and Rehab reports 14 residents who are positive and 2 staff positive. Heritage at Irene Woods reports 11 residents who are positive. King's Daughters and Sons Home reports 5 residents who are positive and 1 staff. The Village of Germantown reports 4 deaths, 5 residents who are positive, and 2 staff. Hancock Group Home reports 2 residents who are positive. Lakeside Behavioral Health reports 3 staff who are positive. I'd like to also give you some indication of the breakdown of the cases by demographics. Blacks make up 68% of the cases, and also people between ages of 25 to 64 makes up 72% of the cases. Individuals less than 18 only makes up 3% of the cases that we're experiencing. Would like to also encourage people to get tested. As Mayor Harris indicated, there are several new sites available, and it is very important that we get as many people as we can tested, especially as we move into the conversations of reopening our economy. So we're encouraging even those who have mild symptoms to go get tested. We're also encouraging that if you are sick, stay at home, don't go to work. We're also encouraging employers to continue to monitor your employees, check their temperature, ask about symptoms, and do not allow any sick employee to work. Continue to supply PPE to your employees and encourage safe distancing, as well as avoiding gatherings as much as possible. Lastly, I want to remind folks that we are still in need of volunteers, and you can volunteer by going to our website, tnmrc.org, and we'll need all types of volunteers, medical, clinical, as well as clerical and non-clinical. With that, I will end and entertain any questions you may have.
Bill Dries with the Daily Memphian.
Yes. My first question is, what trends do you see in the day-to-day numbers, fewer new cases? I think we noted in the statistics from this morning. But my larger point is, are we seeing what's happening with the virus in real time at this point?
This point, numbers are continuing to grow. It doesn't appear to be growing as fast.